Jennifer Pepper is President and Chief Executive Officer of Choices, Center for Reproductive Health, and Amol Sinha is the Executive Director of the ACLU of New Jersey. Thank you both for being with us today. And I think I'd like to just start with you telling us a little bit more about yourself and your background, the organization and the work that you're leading related to reproductive health. And Amol, maybe I can start with you.
Sure. Thank you so much, Priya, for having us. Good to be with you. So my name is Amol Sinha. I'm the Executive Director of the ACLU of New Jersey. I am a lawyer, and I've been involved in public interest law for all my career. The ACLU is a 103-year-old organization, and we are truly a multi-issue and multi-tactic organization. We use a model that we call integrated advocacy, which is using all of our tools in our toolbox, including litigation, legislative advocacy, community organizing, strategic communications, public education to achieve the transformational goals of the future that we have for ourselves. So I've been involved at the ACLU of New Jersey for about 6 years now as its executive director. And I come from, having been at the Innocence Project for a couple of years, working on criminal legal reform, and at the ACLU affiliate in New York for several years, working on immigrants' rights and criminal justice. And so the work of reproductive justice and abortion access at the ACLU of New Jersey is at the forefront these days. And we have been doing a lot on that front, and both in terms of litigation and legislative advocacy, and also community education and organizing. And I'm sure we'll get into some of the details soon. But as with all of my colleagues at the ACLU across all 50 states, and DC and Puerto Rico, abortion and abortion access is among the top 3 priorities for every single ACLU affiliate across the country.
Wonderful. Thanks. And thank you again for being with us. Jennifer, we'll turn to the same question.
Yeah. So my path in reproductive health rights and justice started very early. I am the product of a very loving, tough single mother who was able to access abortion for a lot of the same reasons that people access abortion, for the love and care of their existing children and needing to take care of them. And so I was fortunate very early on to understand, I have better words for it now than I did then, but that family size really impacted people's ability to move through life and to access opportunities. And I am incredibly grateful that my mom had access to those services when she needed them. I am currently the president and CEO of Choices, the Center for Reproductive Health. We have been in Memphis, Tennessee since 1974. We were founded out of the feminist women's health collectives in the early 70s. And we have been providing first trimester abortion services to the Mid-South community since then. We also, in 2021, opened up the very first birth center in Memphis, Tennessee, and became the first nonprofit in the country that was providing both birth and abortion services in the same space, because we know, you all know, it is the same person that needs those services at different points in their reproductive health. We also, learning that the Supreme Court would hear the Dobbs case, moved very quickly, and sometimes I'm not even sure how we did it so quickly, opened up a second location. I like to say our second location in Carbondale, Illinois, which is in southern Illinois. It is they describe themselves as a blueberry in a big bowl of tomato soup. And they are 3 hours from Memphis, 3 hours from Nashville, and we are able to continue to provide abortion services there, as well as our gender-affirming care services, which is quite another issue that deserves some attention. And so spent my life in public health, in the abortion space, contraception, family planning, but also HIV care and prevention is another thing that is deep and dear to me. And it's all my mom's fault, because she talked to us about sexual health in our bodies from a very early age.
Well, I love that. And I love that so much of your work is being led by the experience that your mom had. And I think that point you make about abortion care, not just being about, I don't want to have a baby, but
Mm-mm.
a financial perspective, from an ability to protect the rest of our family, that this becomes necessary. And I think that piece gets lost in a lot of the conversation around this issue. So thank you for sharing that. I want to start by talking about access and sort of what we're seeing in terms of individuals being able to access these healthcare services when they need them. Amol, can I start with what you're seeing nationally, and specifically, not just, I guess, generally for what is happening for women, but specifically what's happening for women of color and those living in poverty that already were sort of challenged in gaining access to these services?
Sure. So let me zoom out a little bit and just talk about what Dobbs did, right? The decision itself overturned 50 years of precedent and the law of the land, which was Roe versus Wade, which protected the constitutional right to an abortion. And Dobbs, for the first time in our history, the Supreme Court decided to take away a constitutional right. And it is no longer protected, and it is up to the states. And so what that led to was now over 20 states, either outright banning or severely restricting the right to an abortion. And the ACLU is involved in litigation in a number of states where we've been successful in some and unsuccessful in others in trying to block those bans and trying to make sure that we hold on to the right to an abortion and access for as many people as possible for as long as possible. So what we're seeing is that there are some states that have outright banned abortion altogether, so it is impossible to get an abortion legally in those states. We have other states where it is effectively impossible to get an abortion, even if it is not something that is outright or fully banned. And what we're seeing now is a patchwork of legality. And so by the accident of one's birth or where they happen to live at the time that these bans went into effect, at the time that Dobbs was decided, you have a very different sort of set of rights depending on where you are. And so what we're seeing is people who have means will always be able to receive the care that they need because they can go to the places that will allow them and afford them the right to an abortion. However, the people with lesser means, and as we know in this country, socioeconomic status and race are inextricably intertwined. So this is going to be overly burdensome on people of color, particularly Black women. We're seeing those people having limited rights and their rights not being fully realized and having a tougher time getting access. And so in New Jersey, what we've seen is there are folks who are coming into our state to receive an abortion or to receive care because we are one of the states that have codified the right to an abortion and have only done so recently, but I can talk a little bit about that. We are one of the states that protects the right to an abortion for people who are coming here from out of state. And what we're seeing more of, and I keep in close touch with our local abortion providers. We were part of a network of advocates. What they're seeing is people are coming to New Jersey not from places where there is an outright ban, but from places like New York, and which is surprising because New York protects the right to an abortion as well. But New Yorkers are now experiencing lines and long waits before accessing an abortion because they're being flooded by people from states from around the country where getting an abortion is impractical. And so New Yorkers, it's easier for them to cross the river and come to New Jersey. And it is harder for folks who may see New York as the transit hub to realize that New Jersey can be that place as well. So what we're experiencing and what we're seeing is a lack of access for people of color, people who are experiencing poverty or are not of means, and also we should know, undocumented people and people who are uninsured or underinsured. Even in states like New Jersey, where abortion is codified as a right, we're still seeing people not having access to that right because it really can be prohibitively expensive if you are uninsured or underinsured. And so the undocumented community members, people who are living without insurance, are having just as much trouble as they did before Dobbs came down, because that right has never been as equitably accessible as it could have been. So that's some of what we're seeing, and it's really sort of troubling to know that we live in a world where there exists now fewer rights for people than there did before, and it is something that is alarming. And I think states like New Jersey and others that are politically poised to do so need to do whatever they can to make sure that the right is codified and that it's as accessible as possible for as many people as possible.
Yeah, well, thank you. And I actually didn't realize that was happening between New York and New Jersey, and that folks had to sort of cross the river in order to get the care that they needed. And as I mentioned, Michael couldn't be with us, and he sends his apologies for not being able to join. But had he been here, he would have shared some of the access issues that were in place before the Dobbs decision even came out, right? And he had worked primarily in Michigan, and I went to grad school with him, and I remember in class back in 2010, him sharing some of the challenges with access and the shortage of providers. And so it's not something that was new because of Dobbs. It is just something that has been totally exasperated as a result of this decision. And Jennifer, would love to hear your thoughts on these access issues. And then also, like, how did you decide on Carbondale, Illinois for your second clinic?
Yeah, I think you're hitting it right on the head, right? Roe never guaranteed access, and there were never enough providers. There were 90% of the counties in the country without a provider pre-Dobbs. Over 100 clinics have closed at this point. So it is really an exaggeration and exacerbation of an existing issue for a long time, right? Yeah, how did we decide on Carbondale? Well, I am originally from the Illinois side of St. Louis. So I had grown up in what we call the Metro East area of Illinois. And so I was familiar with Carbondale, as family had gone there to go to school. There's a large state university there, and family and friends had. And I'd also been keeping track of what was happening in Illinois legislatively with the Reproductive Freedom Act and all of the different things that the state government was really doing as early as 2018 and 19 to codify abortion rights and to really ensure access and remove barriers for folks. So I was sitting in my office with my chief clinical officer one day and listening to, I'm sure, NPR or something, and they started to talk about that the Supreme Court had given cert to the Dobbs case and that they would hear the Dobbs case. We knew immediately that meant we would lose abortion in the next 12 months. We had been keeping track. I also went to the same undergrad as Amy Coney Barrett. She's older than I am, so we weren't there at the same time. But so I'd had a particular interest in her appointment and had been watching and just doing the math. And there were too many Federalist Society judges. The Dobbs case was never going to work out in our favor. We couldn't see how that would ever happen. And so we moved very quickly. I said to my executive team, look, I think it's this college town called Carbondale, Illinois. It's 3 hours from Memphis. It's 3 hours from Nashville. There's a train, an Amtrak that goes from New Orleans, stops in Carbondale and goes all the way up to Chicago. And it's a college town. So I think in a lot of ways, it will be welcoming and affirming for us. And that is indeed what we have found. We were very intentional. We visited Carbondale for the first time about a month before the oral arguments in the Dobbs case and started to meet with people through connections we had, started to develop relationships with the local nonprofits and with some other community leaders. We're just really intentional about building community, because we know that with a healthcare provider that provides abortion, a lot of other stuff comes with that. Protesting, media attention, and we also knew just given what was happening in the world. And so we wanted to be real sure that Carbondale felt like we were coming to them as a partner and not just plopping down a clinic in their community that, quite frankly, hadn't had elective abortion in their community since 1985. So we worked really hard. We were able to get open. We continued to provide abortions in Memphis until the very last day. We provided. I'm really proud of my staff. The Dobbs decision came down on a Friday. We had a 48-hour waiting period in Tennessee we'd had for years. They decided, not me, decided they were going to work all day Saturday and all day Sunday to provide abortions to patients that had met the 48-hour waiting period. They were able to see about 50 patients over that weekend. And then that Monday, our 6-week ban went into effect in the state of Tennessee. We were the only provider in the Memphis area that continued to provide abortion under the 6-week ban. And then in late August, the total abortion ban in Tennessee went into effect. We were able to start providing abortions in Carbondale of October of last year. And we have already seen in Carbondale almost 3,000 patients that represent 16 states across the country. And we had started to see that when Amol talks about, the clinics' long waiting periods and folks in access states having to go to other states to access care. We had started to see that when SB 8 went into effect in Texas, and all of the folks in Texas had to leave Texas to access abortion care, that they really started to push other people out and further and further and further to get care. And so that has continued to happen. We're just so proud to continue to provide abortion care. We know it is a critical component of reproductive health care, and we will continue to find ways to do that. Thankfully, Illinois has just been as incredibly supportive and wonderful for reproductive health care, both in terms of abortion, but gender affirming care now and all of the other things. And thank goodness for states like Illinois and New Jersey and other places.
Yeah, so I'm going to go off script a little just to dig into something that you said. You talked about the wait times as well. And so with a new clinic in Carbondale, Illinois, just from a practical standpoint, if someone needed to come from another state and they show up, are they able to be seen, or do they get put on a wait list, or how does that work?
Yeah. People can call us, we make an appointment. We can right now get people in about a week, depending on what they need. We can also help them and support them to get to another clinic if they need services beyond our clinical capacity or expertise. And we also provide a range of financial assistance to folks so that the cost of care is not a barrier to getting there. We currently have support that if somebody comes to us from a state that has banned abortion, we can cover the cost of their abortion at 100%. And so the idea is that leaves whatever cash they have available to get to the clinic, to drive to Illinois, to stay overnight. And even for folks who don't have those resources available, we have additional resources that we can go to help support them in those ways. We recently had a patient ride a Greyhound bus from Louisiana for 48 hours to get to us in Carbondale. She showed up, needed some additional medical care before we could provide the abortion for her. And our staff rallied, was able to get her seen at the local hospital, get her some IV hydration. We were able to put her up in a hotel in Carbondale overnight, and then see her and provide her abortion the next day, and then put her back on the Greyhound to go home. That is horrendous that somebody has to go through such lengths to access basic health care.
Right. Yeah, it's hard to believe that this is happening in America, right? You always think we have the best healthcare, and now we have a system that can't provide basic healthcare services to people when they need them and where they need them. And, it's not just the transportation costs or a hotel or the cost of the abortion, but many women have children. And so what do they do with their kids when they have to be here? They have jobs that they may or may not be able to leave in order to take care of this. So I think it's heartbreaking to know that, a woman had to be on a bus for 48 hours, but thankful that she was able to come to Choices and get the care that she needed. And your team and staff sounds amazing, and their ability to empathize and be compassionate to those that walk in the door and get them what they need, which is amazing. So we've talked about access. Now I want to switch to advocacy. Amol, in New Jersey, you mentioned that they have codified the right to abortion in state law. Can you share a little bit about how that came about and sort of what's happened since to make it even more protected for individuals in your state?
Yeah, sure. So, like Jennifer was saying, when the court, the Supreme Court of the United States, when the makeup of it shifted, we quickly realized that abortion was going to be one of the first things to go. And so we were talking to our lawmakers and others in the state to say, like, look, we understand that the right to an abortion is protected through case law in New Jersey and through regulations. However, it's a really important thing to make sure that we have legislation protecting the right to an abortion as well, so that it's clear, right? Like that we don't have to flip through pages and pages of decisions and look at the minutia of regulations to understand what right is protected in New Jersey and what's not. And it was a tough fight, even in a state like New Jersey, to get this done, because the right to an abortion in New Jersey that was sort of designed through case law and doctrine is perhaps one of the most expansive rights in the country. And what we wanted to do was to make sure that when we codify something into legislation, we're not codifying anything less, and that we're codifying the right to as expansive as it could be. So in New Jersey, the right to an abortion that has been codified, which was again a sort of an uphill battle to get there, is one that does not have a gestational limit, right? And there's no line in New Jersey's law. So and it is actually sort of a codification of the right that existed as true to the case law as it could be. And we also have there was a sort of a line in the law that initially said that the right to an abortion in New Jersey is fundamental for every resident of New Jersey, and we changed that to mean to say anyone present in the state of New Jersey, which gets to the point of people traveling into the state, so that if there is ever an attempt to litigate or prosecute somebody for seeking an abortion in our state, at the very least, our state law allows for it, and explicitly so. And then what we also had advocated for was not just codification. Our work, thematically was always about rights, equity, and access, making sure that we are codifying the right and then ensuring equity and access in the work, and making sure that everybody that needs an abortion could get one. So we had advocated for something called the Reproductive Freedom Act, which incorporated both rights, equity, and access. However, we only got the rights codification piece because of political negotiations and all of that. So the thing that's left for us to do, and the thing that we're currently advocating for, is called the Reproductive Equity Act, which would allow for New Jerseyans of any background, whether they are insured, uninsured, underinsured, undocumented, to be able to access funds to receive an abortion if they need one. And so we want to make sure that we are using all of our tools, whether it's the budgetary process, the legislative process, regulations through our Division on Banking and Insurance, or whatever it might be, to make sure that the right is fully protected and fully accessible. Another piece of advocacy that I wanted to share that's outside of New Jersey, and I wanted to share it in the time allotted, so I'll do it real quick, is that the ACLU at the national level has created something called the Abortion Criminal Defense Initiative. And, I never thought that we would have to string those words together, but here we are, where we have hired a bunch of criminal defensive lawyers and abortion advocates, repro advocates, to come together and think about defending people who are either seeking an abortion or are providing an abortion in a state where it's restricted or prohibited. And so we are, I would say, uniquely equipped because we do have criminal defense lawyers in in the ACLU, and we also have reproductive rights lawyers in the ACLU, and we're sort of marrying the two and creating this project so that if somebody needs legal representation as they are in the process of seeking an abortion or providing one, and they're being prosecuted, we can step up.
Yeah, thank you for sharing that. I didn't realize that that was happening, and it is a sorry state of affairs for our country to have to combine reproductive rights advocates and criminal defense attorneys together. But again, thankful that you all are doing that for those in the country that need that support. Jennifer, what are you seeing from an advocacy perspective? You talked a little bit about going into Carbondale, but you're also in Memphis, which it's almost like you're in two different worlds given your two clinics. So what has been important from an advocacy perspective?
Yeah, I mean, it is two entirely different worlds. In fact, the Illinois state government and the governor's office has been so supportive. It has felt really weird to us at times, like to have them call and be like, "How can we help you?" And it's like, "Is this a joke? What are you talking about?" Because we are constantly at battle with the Tennessee state government and the legislature, and so we have, at this point, in Tennessee, we are really focusing on how do we create systems and support and laws that actually support pregnant people and birthing folks, because that's what our legislators say they care about. I would argue they don't actually care about pregnant people and babies, but they say it a lot. So we are working to hold them accountable to that in a lot of ways. It's really hard in a state like Tennessee that you have such an incredible supermajority of conservative Republicans in all the levels of the state government. It is really hard to get things moved. And so we are doing some work around what does a long-term state plan look like. I think we have pretty much all resigned ourselves to the fact that abortion in Tennessee is at least a decade out, if not more, unfortunately, unless we get some kind of federal protection for the right to access. But also, Tennessee has one of the lowest reimbursement rates on Medicaid for prenatal care. And so trying to work to get that up. We don't have any laws that provide time off for parents or provide support for nursing folks or any of those things. Quite frankly, our Department of Children and Family Services is atrocious, and it's not able to take care of the amount of children that have come into the system. And so trying to work with child advocates around what does that look like? How can we help there? And really leaning into the reproductive justice framework. Like, abortion is important, of course, but lots of people already have kids and they deserve the rights to raise those children in their communities in a healthy and safe way. And so that is really our kind of how we are shifting our focus around advocacy in Tennessee. And in Illinois, really working with our folks and really supporting them to continue to do things. They're working, Illinois, the governor today signed a law around crisis pregnancy centers or anti-abortion centers that will penalize them for providing misleading information to people seeking abortions, which is really important. In contrast, the state of Tennessee has given anti-abortion centers about $20 million out of our state budget this year to do whatever it is they do, which is not provide health care for the most part, unfortunately. And so just trying to work on all aspects of what the reproductive justice framework calls us to really think about for our folks.
Yeah. And in the last few minutes that we have, I do just want to get both of your thoughts quickly on, we have an audience of individuals who are a mix of folks working in healthcare, lawyers, others. What do you recommend that they do to help protect their own rights and the rights of others to reproductive health in the current environment? Jennifer, maybe I'll start with you.
Be courageous. Live courageously. Talk about your support for abortion access and the full range of sexual and reproductive health care to be available to people. Think long and hard about things like boycotting states, because there's still a lot of good people in these states. And let's not turn our back on the South and the Midwest and things like that. It's not the state, the people of Tennessee. It is our very gerrymandered political system and the folks that are in power. And so continue to love your Southern and Midwest neighbors and be courageously open about your support for these rights and have conversations with your friends and family.
That's great. Amol?
Yeah, I'll echo some of that. I think one of the most important things we can do is openly talk about these issues and make sure that lawmakers know that you support the right to an abortion and access for all. It is abortion is a winning issue in New Jersey. And it's a winning issue in many states. I think there are way too many lawmakers and way too many politicians that are scared because they're not hearing from the people that are on the right side of this issue. They're hearing from the opposition. And the opposition oftentimes, as we know, is a lot louder because the people, for instance, that write Yelp reviews are the people that have bad experiences or are against a restaurant, not the ones that love their experience, right? So we want to make sure that we're just as loud as the opposition is. Another very hyper local and sort of concrete thing that folks can do is to donate to or join in volunteering for a practical support organization.
Mm-hmm.
So these are organizations that are providing the practical support for people who are seeking abortions who don't have the means to get to an abortion clinic or somebody to either drive or provide transportation or provide funding or provide a night to a place to stay at for a night, things like that. Many states have them. New Jersey has a couple, and I highly recommend for people to get involved.
Yeah.
Wonderful. Well, thank you both for being a part of this event tonight and for sharing your perspectives. I learned so much from you, and I think my takeaways for everyone here is to be courageous, live courageously, share that you support the rights to abortion, and to openly talk about the issues. Amol, I think that point about them hearing from the opposition more than those that support it is really true. And
yeah.
So sending letters, writing to your elected officials, even if they're on the same side of these things as you, to say thank you for being on the same side is really important and goes a long way in these advocacy efforts.